So let's take a look at the randomization. So here's a question. Why do we need randomization? Do we need it to eliminate differences between groups, to reduce known and unknown bias, or to make the study more representative of the US population? You can hit the pause button, and when you're ready, we can continue. So the answer is that it reduces known and unknown bias. Randomization does not eliminate differences between groups because it uses a process of chance to try and reduce differences, but there is no guarantee that the differences will be eliminated. So eliminated is a little bit of a strong word to use in this case because it's a process of chance. On average, the two groups will be similar on known and unknown characteristics. And that's why the very powerful feature of randomization is the fact that it can control even the unknown bias, not just data that we collected, but also data that we did not collect. And that is really the very, very strong feature. So in other studies, in observational studies, we need to know exactly what we are collecting. If we forget, then it will be problematic. If we're using randomization, then the data collection is actually might not be as problematic because of the randomization process. We are not using randomization to make the study more representative because randomization is simply assigning individuals that have already been selected from a population to receive the treatments. And so if this group is purely male or purely female, then that would not make it more representative of the whole population of male and female together. So how does randomization work? So we might start with a target population, let's say males aged 60 to 80, and then we randomly select a sample. So this would be again males aged 60 to 80. And then from there, we randomize. So we randomly allocate participants to either drug A or B, or it could be to a treatment, to 2 treatments, or even 3 treatments. This could be a surgery, behavioral, any type of intervention that we make. And why do we randomize? Again, we do not randomize to make the participants more representative. We randomize so that these 2 groups from A and B are more comparable. And so on average, they should be similar except for the interventions. So if the randomization worked, they would be similar besides the intervention that was given. In this case would be the drug. So if we were to use a population of females, young females aged 10 to 20, then our sample would be females 10 to 20. So what's the difference then between random selection and randomization? In random selection is more how we select participants from the population. And we can have different types of sampling strategies, for example, a simple random sample or a convenient sample. And randomization is once you have selected a sample, now you're applying the intervention. And so you're randomly assigning participants to control or treatment. So potentially you're using chance in both times, in random selection and randomization, but these 2 processes are not the same. And so your participants might be simply a sample that is a convenient sample, maybe some patients from the hospital. So that is not a random sample. However, you can still use on that sample, you can use randomization. So randomization is the random allocation to 2 or more treatment arms. It could be drug versus placebo, that's the more typical, but you could also have a low, medium, and high dose. So here you see there is no drug or no treatment. And then you can also compare surgery versus no surgery. The best way to do randomization is to use a computer-generated random number. So that is done through certain programs available. There are programs in SAS as well where you can use to do that. The reason you want to use a computer-generated random number is because you want to then be able to say, this is what I did, this is how I got the participants, and so it can actually be traced back to the original group of numbers that you used. You could flip a coin, but the coin, nobody, once you're done, there is no trace of that. So the best thing you want to be looking for, if you're doing a clinical trial or you're reading about a clinical trial, look for this computer-generated random number. The two then, these groups, these arms, will have on average, and again, remember the word on average, this is not always, so this is not eliminating differences, but on average, the two groups or the three groups will have comparable characteristics, both measured and unmeasured. That is also another keyword. So you don't have to worry about measuring everything. That means, for example, if we were in a group of people and we are randomized to group A or group B, the group A, group B on average would have the similar height, the similar cholesterol levels, would have a similar average age from the two groups. That is on average. That means randomization doesn't always work because sometimes just by chance you might have some uneven, especially when the groups are small. So, but if you forgot to measure, for example, insulin levels, you know that by chance the two groups will also have similar insulin levels, and that is the beauty of randomization. A study that is not randomized will be a quasi-experimental design, and that is of a lower level of than compared to randomized trials. Now, randomization is only one part of the story, because you randomize participants, then you give them a treatment and you follow them up for an outcome. Now, if the follow-up is fairly long and then participants start getting lost to follow up, now your randomization becomes a little bit shaky, because now the two groups are becoming non-comparable, especially if the dropouts or the attrition happens in one group for a particular reason that is different from the other group. So let's see now how you can randomize. Take a look at these 4 options and select one. Now, so you could use visit. So the first 10 patients that walk through the door, we're going to give them drug, and the next 10, they'll get a placebo. Or we can give the drug on certain days of the week and placebo on other days. We can flip a coin if heads is drug and tails is placebo, or we can do any of these procedures. Now, if these were the only procedures you had available, which one or ones could you use? Hit the pause button and think about it, and then we will continue. So this is what the answer that I saw from one group. I asked, and then here's the answer. The majority thought that all of the above would work, and 1/3 thought that flipping a coin would be the only option, and then a smaller percentage of responders thought that either using the visit or the day of the week would work. The answer is only flipping a coin. The other options are not good options, and they're really you're not randomizing. Here you're introducing some bias, because the first 10 patients may be very different from the next 10 patients. So the first 10 patients may be the ones that are more enthusiastic, that they're gonna feel better or healthier. So we don't know, and so it could be a difference in the two groups. Same thing for the day, because Monday, Wednesday, Friday is not the same as Tuesday, Thursday, Saturday. Now, on Saturday, there are people who work that can come, but if you're not working, you can come anytime on Saturday. So the two groups might actually end up being different. That is not randomization. So the only one that really works is coin, if this was the only option.